One of the difficult fractures that happens that I take care of is what we call a proximal humerus fracture. So it's a complex injury. It involves the shoulder joint. And usually when somebody falls and breaks their shoulder, it is in the shoulder joint but involves the upper part of the humerus bone, the arm, or the ball side of the socket. And so there's a variety of treatments for that. Often we can treat them non-operatively. If it's just got a crack in it, we treat it without surgery. Whereas if you had a crack in the equivalent place in your femur or hip, we would treat it with surgery to stabilize it so that you could walk. We can rest the arm, we can't rest the hip, and so there's often the opportunity to reasonably successfully treat those fractures without surgery. However, if it fails to heal or if it's blasted into a lot of pieces, and there's various parameters for that, we can fix it with plates and screws, a combination of plates and some complex constructs with the same sort of sutures we use to repair rotator cuffs, or even replace it if necessary. And so in our group here and in some of our referring hospitals, I end up seeing those patients because there's a judgment call to make whether or not to go to surgery, and there's also a judgment call to make within surgery whether it's one that can be fixed or should be fixed versus one that should be replaced. So that's my sort of specialty interest that is, I think, an asset to our system and our community.